Assalamu alaikum wa rahmatullahi wa barakatuh. The inconvenience of having menses while performing Umrah or Hajj is a daunting thought that most women have when undertaking this journey. It need not be so, as help is available. A woman may wish to postpone her menses if they coincide with her performing Umrah or Hajj, especially the latter, as there may be time constraints when return air travel after Hajj is over. It is a real problem in some women, and it needs to be addressed. There are different categories of women that we need to look at. Most women who have a regular cycle and can predict the next one within a day or two should work out the time of their menses during their stay in the Holy Land. If the normal time of menses falls at a convenient time for them to have a period, they should not interfere with their menses. If the menses falls at a time which would interfere with Umrah or Hajj, then it can be postponed for a later time. Those women who have irregular cycles, where it becomes impossible to work out when the cycles will appear, should regulate the cycle before they depart using combined oral contraceptive pills. Those women who miss periods due to a variety of situations like perimenopause or polycystic ovarian syndrome may also feel uncertain whether their menses will come or not and when, but they also can use a combined oral contraceptive pill. Now, how do you postpone menses? This should be done in consultation with your doctor. Combined oral contraceptive pills can be used to postpone periods. The biphasic combined oral contraceptive pills are the best to use. These can be identified easily as they have only two colored tablets in the pack, the active tablets and the inactive tablets. The active tablets are the hormone tablets and the inactive tablets are without hormones. The active tablets should be continued from one packet into another to extend the non-bleeding days when bleeding is not desirable. A period should not be delayed for more than 2 weeks as breakthrough bleeding can occur. This bleeding can sometimes be very heavy. In some women, the pill may cause some unpleasant side effects like mood changes, breakthrough bleeding, painful breasts and headaches. Most of these side effects last for about 3 months. If a woman has taken the contraceptive pill previously and has had no side effects, the chances are high that she would tolerate the pill better. This same pill should be used in her situation. In any event, it would be better to start the contraceptive pill at least 3 months before departure so that the side effects would not cause a problem. In my experience, a biphasic combined oral contraceptive pill with low-dose ethinyl estradiol, say 30 micrograms, and enough progesterone, say 150 micrograms, to keep the menses away, that usually works very well. You may also use a pure progesterone tablet, like norethistérone, like a tablet called Primolut N, Primolut N, Primolut N. At this 5 milligrams of norethistérone, taking one tablet 3 times a day, starting at least 4 or 5 days before the expected period, can postpone a period for as long as you are taking them. When it is convenient for you to have your period, stop the tablets and your period should come in the next 2 or 3 days. That's at a convenient time for you. In case of sudden unexpected bleeding a day or two before Umrah or Hajj, sudden unexpected bleeding a day or two before Hajj, a tablet called cyclocapron may be used. This is tranexamic acid, tranexamic acid in a dosage of 2 tablets 3 to 4 times a day usually stops the bleeding within 24 hours. However, remember there are contraindications to taking the oral contraceptive pill. These should be borne in mind, and some of these more important ones are people who smoke carry a higher risk, people who have large varicose veins, people with a history of thrombosis in the superficial or deep veins with or without embolism, liver abnormalities, and known suspected estrogen-dependent cancer, severe migraine, and cerebrovascular insufficiency. If this is planned well in advance, you should have a wonderful Hajj without the inconvenience of having your periods at a time when it's inconvenient for you.